Yeah.
Hello everybody, I'm here today with Bernd Giesenhagen, the inventor of the bonering technique. You are my boss.
Somehow. My name is Bernd Giesenhagen. I'm from Germany, specialized in implantology, especially in augmentation procedures. I invented the bonering technique approximately 14 years ago. The first patient was a young lady. She had a bone loss around an implant. I thought, how can I do a re-augmentation from this defect? Maybe a ring design graft would fit to compensate this defect. And then I invested a bone ring, put it around to close it, but it failed. But with this idea, the bonering technique was born, because I thought maybe it's a very good idea to use this kind of procedure for augmentation. Nowadays, again, we use it almost for all indications.
Okay.
Contraindication or the limitation for the bonering technique, if you have a very, very thin crestal bone, and if this crestal bone is parallel thin down to the bottom, then you can't use this technique. Then you have to go for a two-step procedure. The bonering technique is a very sensitive technique. You need to follow up the step-by-step procedure very precisely. If you fail first time, I think you will never do it again. 100% of my failures are related somehow to the soft tissue. If your flap keeps close on top of a ring, it will heal.
Thank you.
Yes, I will show you a case I did many years ago, and in the first 7 years I used the bonering technique only done with autogenous bone rings. My favorite area is a processus palatinus. In this area we find the best bone quality what you can get intraorally. You can only harvest bone rings from the processus palatinus in edentulous areas. Don't try to do it on top of roots, only in edentulous areas. Like you see in this case, we miss the two lateral incisors with a huge bone defect, and we have a mobility of 3 from the central incisor. And our treatment plan was to extract the central incisors, make socket preservation, and make a compensation of the defect from the lateral incisors with 2 bone rings harvested from the processus palatinus. Please only in edentulous areas, and then you have a lot of bone, up to 6-7 millimeter, 8 millimeter you can get from the processus palatinus. Don't take a bone ring on top of a root. So you see, after extraction, I make an incision, crestal incision, and 2 vertical cuts into the vestibulum. Then I prolongate this vertical cuts from the vestibulum into the palate, cut nervus incisivus.
You cut nervus incisivus. It's not a problem?
No, it's not a problem. It makes no problem for the patient. Sometimes patients say, if you feel a little bit discomfort during brushing teeth on the palate, but this disappears after a couple of weeks. I just go 0.5 millimeter into the bone to mark the position of the rings. And then I do my implant bed preparation into the bone, and then we designed with this procedure a ring design graft. I harvest the grafts, store them in the blood of the patient, and the defects we fill up with a collagenous sponge. And if you look at this picture, you see how nice we can reconstruct the design of the maxilla. Like Yuge alveolarie, we can very nicely reconstruct with a bone ring technique. This is very important later for the aesthetic outcome, and we have a lot of bone on the buccal side from our implant. Then we fix a membrane with 2 titanium pins, put Therabone bovine bone graft material on top. Then I have to do another vertical incision here, because I want to cover each ring with a mucosa. Lass mal weg, ne? Nein, schon richtig.
Zurück.
And I harvested 2 gingiva grafts from the palate, make a socket preservation with these 2 gingiva grafts. Now surgery is done. 1 bone ring, I make a transposition from here to here, 1 from here to here, and for the central incisor we make socket preservation with Therabone and with 2 gingiva grafts. This is the X-ray 3 months later. healing of the soft tissue 6 months later. And then the re-entry was done with a meander technique, was done by my colleague from Lithuania, Darius Pochebutas, starting the prosthetic part with a lab-made screw retained temporary, because we want to create here in this area to get a nice emergence profile over the pointings, to get a very nice gingiva margin. This is 7 months later post-op X-ray. This was a prosthetic part. And finally, 1 year after loading, you see we have a stable bony situation around our implants. The bone is located on the shoulder of the implant, a little bit subcrestal.
Thank you very much for the interview.
Thank you.
Have a nice day.
To give me the opportunity.
Okay. And we'll see us. Ciao.
So, jetzt habe ich schön was zum Schneiden. So, ein paar Tage Arbeit.